COVID-19 has been one of the most challenging situations for everyone, especially healthcare workers. For Dr. Ruchi Samdani, the biggest question was how she would ensure that chronic kidney patients needing dialysis at least thrice a week would be taken care of.
Initially, when the COVID-19 pandemic started, most of the dialysis centers were shutting down because the staff was getting infected. Now, dialysis is a very basic necessity for patients whose kidneys are not functioning. So it was a very trying time because we had to arrange dialysis for them at some center or the other. We had a very good support system in Bombay in our nephrology community, and we really helped each other in doing that and enabling that every patient gets dialysis. But arranging that was an emotional turmoil.
For Dr. Samdani, the biggest personal challenge at the peak of COVID-19 was to ensure that her young daughter is not infected. Like many COVID warriors, Dr. Samdani put her duty first, even if it meant living in isolation from her child for 8 months.
The biggest challenge was being able to maintain the work and home balance for me. I have a daughter who's 8, and my husband is also a frontline COVID warrior. So for us, the moment the first wave hit and the ward started filling up, we three were in isolation. It was almost 8 months before when the COVID number of cases started going down, when we met my daughter, because she started howling and said that my Christmas gift should be a hug from the two of you.
Women doctors who dedicated themselves to putting their patients first are truly inspirational.
She cannot work 100% and say that I'm not achieving enough, because she has to put in that 20% extra, because she's also managing her home and her family, whether it is parents or in-laws or kids or relatives or the family life. Or if only one aspect is doing well, the female is not going to be happy. So we want happiness something missing. So we want happiness in all spheres. We want happiness in work, we want happiness in family life. So for us to be able to achieve that, we have to put in that 20-30% extra. Only then we'll be able. But I know that women can do that because they are made of steel. They are so strong.